Good evening, viewers. Welcome back to another episode of Health Talk. So that normally comes on you every Wednesday on Suicide TV. Today, I have one of our guests. I will allow him to introduce himself before we proceed. Sir, you are welcome. Introduce yourself.
Yeah, thank you very much for inviting me. Good evening to all the viewers. My name is Ebrima Dibba, SEN midwife, working at Falafel General Hospital, and I'm in charge of antiretroviral clinic.
Our discussion is going to be centered on HIV and AIDS. This is a virus that, or is a disease that most of us have so many myths or misunderstanding about it. So today, inshallah, he is here to make things clear for us. What is HIV, Mr. Dibba?
It is very, very important for people to know what HIV really means. HIV is human immunodeficiency virus.
Okay.
It's a virus that suppresses our immune system. That will be we are always prone to sickness.
Okay.
Yeah.
Since now you already know what HIV is all about, so can you tell us the mode of transmission? How can somebody have HIV?
HIV is transmitted in different ways. Basically, during our studies, we know that HIV is a viral disease that can be transmitted through unprotected sexual intercourse.
Okay.
Unprotected sexual intercourse.
Okay.
Other means of transmission is needles, razor blades, and anything that can be able to cut a human being. That somebody can also use it and cut himself. When their bloods are mixed together, it can also transmit you. The other thing is about is parent-to-child transmission,
Okay.
which is very, very sensitive. Because most of our mothers, during their antenatal services, they don't even think about whether they have HIV or not. This is why the Ministry of Health and Global Fund, they come together to make sure that all the pregnant women should undergo a PMTC services so that we can be able to prevent their babies of not to be infected.
Okay.
The other transmission also is blood transfusion.
Okay.
It's very, very vital because blood transfusion, sometimes someone can get the virus from the blood transfusion, the person will not know. This is why anybody who goes for blood transfusion, blood donors, they must screen you for all the viral diseases. So that if at all you are free from all those viral diseases, they can be able to transfuse you, take your blood and transfuse you with the patients.
Okay.
But sometimes it's very, very crucial, about this blood transfusion issue, because I don't like it. I don't want anybody to be transfused. Anybody who is sick, especially the pregnant mothers, I want them to sustain their blood to sustain them until they're delivered. Because someone who is in the window period that's between the time you get the virus and before the muscle will detect the virus will be 3 months or more than 3 months. Less than 3 months, if you are infected with the virus, that's mean the test kit will never detect the virus. So that person blood will be bled and will transfuse to the patient. This is why me personally, I don't like blood transfer. I don't want people to be transfused. Maybe due to circumstances, there's no way I need to be transfused, but it's unsafe at all. Window period is the cause is the major cause of it, because you don't know who is at the window period. During your counseling with them, the time we were trying to counsel them for them to donate, some of these service providers, they don't counsel them on that, and it's a very key vital to counsel them their risk behavior before they come for donation. So this is why, as a service providers, we need to be very, very mindful, especially laboratory technicians.
Okay.
Yeah, and they need to counsel the patients. Let somebody not come and say, I want to come and donate my patient. You sit with the person, counsel him or her. We pass these behaviors. Whether did he ever do HIV counseling and testing or not?
Okay.
If he did not, ask the risk behavior, because sometimes they will black them and they find them positive. So, and if you don't cancel them, you let them go, and you tell them they're not fit. And whilst they are positive, that's why you tell them they're not fit, and they need to be ruled out. This is why counseling is a process, and it's an entry point to any of this care.
Do you have specific medications that you normally give to article mothers that are already infected with this virus for them not to transmit that this virus to their unborn child?
Yeah, the medication is available all over the country.
Okay.
Any major facility, when you go there, or any RCH services, they all have these medications there.
Okay.
This is why the program, the Ministry of Health and the Global Fund, they come together and to make sure that all the pregnant mothers, when they go for their routine services, they have to go under this PMTC services, so that they can be able to prevent their unborn babies. Because if they don't go through the services, they are positive. 9 months of pregnancy, during delivery, during childbirth, and breastfeeding, the virus can be transmitted to the baby.
Okay.
Unknowingly. This is why when they are positive, you need to cancel them to put them on the antiretroviral. That can be able to suppress the virus. When the virus is suppressed and the baby delivered at the hospital, all the necessary precautions have been taken and the baby needs to be on nevirapine syrup. The syrup that can be also try to suppress the virus, and the baby have to take the nevirapine syrup for 6 weeks.
Okay.
After 6 weeks, from there, the baby have to be on co-tri prophylaxis. But if the mother didn't go for alternate services, she is positive, the 100% risk of the baby to be infected is there.
Okay.
This is why we want to make sure every antenatal mother, when you go for services, you need to be checked off for HIV. If you are negative, we cancel you. If you are positive, we put you on the therapy. But sometimes it's difficult. Some mothers, they will deny. This is why those mothers who denied, they are positive, their child end up being positive. Because they will never take medication. Their children will never take medication. And they will never deliver in the hospital. This is why one day I told a maternity, I said, we have to put it as a routine. Any woman who comes without a coding system, that person needs to be screened immediately. If the person is found to be positive, you have to put that person on ART. And if she delivered, the baby have to be on the therapy too. Alongside, we monitor the mother and the child so that we can be able to minimize the mode of transmission from the mother to the child.
Somebody like a pregnant woman who's already had to call it having this virus, and the person have adhered to the woman have adhered to the medication that you mentioned here. Is there any possible means like it means the child will not be able to get the infection or so the virus, or like even if the child gets the virus, it will not able to how to call it stop her the way they should stop.
The studies have shown that if the mother adhere to her medication, they didn't default. Every month she go and collect her medication till her delivery day. She take her medication. The likelihood of that to be infected the child will not be possible. The child is free from the virus. And if the mother also delivered with all the safety precautions, the baby within 72 hours, the baby have to be on nevirapine syrup. Immediately, depending on the weight of the baby. For 6 weeks. After 6 weeks, the baby have to come for EID. That's EID, that's the testing for the baby. All those I come across, they all become negative because of their adherence to their medications. Their babies are also negative. After 1 year or 2 years, we skin them, they are all free from the virus. But the mother is still positive.
Then that's a good news anyway. Though nobody prays to have this virus, but at least if you have it, then you can also do all what it takes to make sure that at least you the parent or you the woman are not able to transmit this virus to your unborn child.
Exactly.
So we move to the one that is the art treatment, the art treatment that you were talking about.
Yeah, antiretroviral. Anytime we say art, is antiretroviral therapy. It's all over the country. All the facilities, the major facilities, and the major health centers, they all have this therapy. But on the side of on the art side is where the hospitals, where they issue antiretroviral therapy, and that's where all the service is being rendered to the clients. When they are graduated from PMTCT, they refer them to antiretroviral art side. That's where we pick them up, register them, put them into care, start giving them their medications. Art is very, very important as far as this virus is concerned. And this art is helping a lot of patients to improve on their health. Because I've been seeing a lot of cases who are clinically depressed, clinically sick. But before they start this art, they have been going so many facilities, but before they know they have this virus, it caused them a lot of problems. But the more we told them, this is the actual problem you are having, when they accept it and we start them on medication, they improved. Very fine. Some people even tell me, Dibba, had I known, I would have come earlier and picked this medication, because this medication is keeping me now to be healthier. Because what the medication does, it suppresses the virus. The virus itself is a very funny virus. It cannot survive on its own. If it gets into the system, it can be there, looking forward, the OIs. You understand the OIs?
No.
The opportunity infections. Like TB comes, grab. Malaria comes, grab. Skin infections come, grab. Those are the OI opportunities. Work with them in the system, trying to bring your immune system down. The more they bring your immune system down, you are prone to diarrhea. You are getting weak skin infection. You don't know what is happening to you. Anywhere you go, they will tell different stories. But the virus is a very funny virus. But the most important thing and the good thing of it, it doesn't kill.
Wait, you are. This is something that we have to make clear about. You say the virus does not kill?
It doesn't kill.
Can you elaborate on that?
Yeah,
please?
because the virus suppresses you. It itself cannot survive.
Okay.
All the OIs that comes into your system
Yes.
work with the virus.
Yes.
They suppress your immune system.
Okay.
If your immune systems are down, then what are you left with?
Anytime somebody has HIV, this virus, or this virus in his or her system, it is, I should say, an opportunity for other infections to come in.
Exactly.
Now, when those infections come in, they will not go do all the tests to make sure that your immune system is suppressed.
Exactly.
So now, let's say if the person dies as a result of that, means the primary cause article of that death is not going to be the virus, but maybe the secondary cause would be the virus, but the primary cause might not be exactly the virus.
Because the primary cause were by the opportunity infections. Those opportunity infections, come together to work with the virus. They suppress you, and you end up in dying.
You understand?
But people saying when you have HIV, you die. You don't die. It doesn't kill.
Yes.
It's the OIs that kills you. TB is the fastest disease killer in the Gambia. TB very fast to kill. This is why now we have a global fund and the program. We have a joint TB collaboration. All our cases, all new cases, need to be on TB and TB therapy to prevent them of getting the TB virus. Because the more you have the HIV virus, you are immunosuppressed. The more you're immunosuppressed, TB is prone to get into you very easily. And the more it gets into you, it depresses you. Your immune system goes down. The more it goes down, you are nowhere to be seen now.
All right.
So now, not HIV that kills you, but TB is very fast to kill. Very dangerous virus. TB is a very dangerous bacteria that can be able to suppress your immune system down so that you can be able to prompt all these upper OIs.
Let's say, for instance, couples. Let's say now you already check the male, that's the husband, and the husband is positive. And the man said he did not want you to inform or to preview his diagnosis to the wife. You as an expert or somebody who specializes on HIV and other things, what role are you going to play on that to make sure that and then because you know the wife is always also already at risk, so what are you going to do in that position too?
It's an ongoing counseling. The husband is positive, don't want to disclose to her partner.
Yes.
It's an issue and it's challenging all over the country.
Okay.
And we have no right to force somebody to disclose. We have no right to disclose somebody's status to the partner. What you need to do is an ongoing counseling. Let the person understand why the virus first. The virus first, and the mode of transmission of the virus, and the importance of taking the medications. Because one, he is taking the medication. He started medications. Now, before 6 months, now before starting the medication, they have millions of copies of viruses. Now you start medication, along the line 2, 3 months or 6 months, you screen it again. Now the virus is suppressing because of the medications. Now, but the partner, you didn't want to disclose to the partner. What you're going to do is you have to let him be on her therapy and counsel him or her to understand the mode of transmission of the virus. If at all, he will be able to understand and disclose to the partner for the safety of the partner. Let him. But if he is not willing to disclose, let him be on his medication. You can't deny him of not taking the medication. He should be taking his medication. But along the line, anytime when he comes to the clinic, talk to him about the importance of his therapy. One, if he is taking the medication, the wife is not taking the medication, he could be S1, HIV1. The wife is HIV2, assuming. Then, if the wife virus goes to him, it will be dual infection. That dual infection will change the medication. You change the medication. Before, medications, HIV2 have its own separate medication. HIV have its separate medication. But now, HIV1 and 2, they all share the same medication. But now, if you are taking your medication, she's not taking her medication, her virus is more, then still now, your medication will be minimal. The effectiveness of your medication will be very slow. Because he's giving you more virus. You want to suppress the virus, so he's giving you more virus. Now, along the line, when you are doing all your monitoring and you're doing your viral loads, you see that the viral load is just going up. And he's on medication for a couple of months. There is a cause of concern. The partner needs to be involved. But if he understands that, he will involve the partner. From man to woman disclosure is easier than from woman to man disclosure. To my experience.
Oh. So you're telling me now it's easier for the man to disclose
Yes.
to the wife
Yes.
than if the wife has it and then for the wife to disclose to the husband.
Yes, exactly.
That's a very
Because there are a lot of
interesting
contributing factors.
I know it's a very wide topic.
Very
If
wide.
you want to discuss more about how things are going,
We'll
it's
be
going to
here
take
the
us for
whole
the whole
day.
day. Yeah. A summary of this on our local language. Mbokk yi ñu leen di ñu ku nekk sa sant yéen ñu leen nekk di ñu seetaan tey suñu kan bu ñu amal fii mooy Ebrima Dibba mu ngi bàyyi ko si Farafenni General Hospital bi te moom lu ñu doon waxtaan mooy affaire bu ñu ñëwaat sida la leen ko di waxtaan te moom naa ko bàyyi moom tamit mu wax ñu tuuti si lan mooy sida ak nit naka la moom mën a amee sida si su ko amee mu ngi ko mën a joxee keneen waa.
jërëjëf Muhammed suma suñu mbokk yi olof yi ak soose yi ñoo xam ne dégg nañ olof doomi jàngoro sida mu ngi gën a bëri si réew mi ñu bari xamuñ ñu bari dañ foog ne doomi jàngoro sida amut docteur dañoo fen lu digga la mu ngi am doomi jàngoro sida daf dee wàll nu mu dee wàllee mooy sëy boo xam ne amu aar paaka daf ko dee joxe lansa daf ko dee joxe puso daf ko dee joxe jigéen bu ëmba su ko amee mun naa wala doomam bi waxtu bu mu ëmbee si wasinekaay ak si nampal may deret tamit daf ko dee joxe may deret naka la koy joxe balaa ñu jël sa deret di ko mayee nit dañ ko dee seet su fekkee ne sa deret bi amul doomi jàngoro sida ak yeneen feebar yi dañ ko dee jël jox ko malade bi su fekkee mi ngi am doomi jàngoro sida duñ ko jël pour jox ko malade bi bos wóorul may deret bi tamit dafa sensitive trop am na ñoo xam ne mu nga am doomi jàngoro sida diggante su fekkee ne wan moon nga ko amee amul ñetti weer sa biir deret bi sa biir yaram bi machine bi du ko dee gis loolu dafa dañ ci war a bàyyi xel trop loolu moo tax man su ma leen nekk di waxtaan ak jigéen ñi ëmba yi dama leen dee wax ne try leen by all means seen deret bi mu yóbbu leen ba ngeen am seen bopp moo gën a óor nit ñëw may la deret yow sa jëkkër amul HIV yow amuloo HIV nit ñëw may la deret ko mu am HIV doomu jàngoro sida daf la ko wàll loolu moo nekk loo xam ne dañ ci war a bàyyi xel trop.
léegi jigéen ñoo xam ne comme daal ñoom dem nañ ba am feebar bu ñëw feebar di sida bi ni kooku nu moo def ba tan aar ne comme du mun a def jàngoro bi jox ko doomam boo xam ne comme kooku juram
jërëjëf Muhammed lii dafa am solo am na ñoo xam ne is difficult am na ñoo xam ne dafa yomba wante yëpp dafa dépend si lan si counseling bi nooy waxtaan ak jigéen bi pour mu understand because nit soo ko ne da nga am doomi jàngoro sida rek dem na
waaw
because fu mu dee xelaat mooy doomi jàngoro sida lu ñu si dee mooy feebar bu bon la bonut doomi jàngoro sida bonut nañ nit ñi xalaat loolu noonu ñu bàyyi loolu si génn gos léegi fu ñu dee xalaat mooy man su ma jëkkee su xamee lii fu moo dafa dama day caaxaan waaye su ma jabar su déggee dafa wax ne man dama day caaxaan lu ma tax ñu bëri su ko waxee rek dañ dee tiit dañ dee mel nii wante doomi jàngoro sida ci fekkee jigéen du ëmb am nga ko ñu wax la ko nga ànda ci sa doom bi mën nañ koo aar du am du feebar bi yëpp ci lan la si garab bi mooy tax yow sa bopp nga am wér-gu-yaram sa doom bi mu am wér-gu-yaram ba nga dem ba wasin soo wasine bi tamit sa doom bi dafay ñëw jox ko beneen garab boo xam ne dañ ko def nafarepin sirop bu daf koo dimbal daf koo aar doomi jàngoro sida du ko dugal gis naa ñu bëri jigéen ëmba ñu bëri seen doom yi amuñ feebar bi léegi buñ nag wax suñu xale yi next generation ñu am ne ñu war a ñëw ñëpp feebar si doomi jàngoro sida bëgguñ ko loolu moo tax garab yi muy am ku ci ànd nag da nga am wér-gu-yaram
jërëjëf docteur Dame ñu la jaajëfal bu baax si loo bëgg wax ni comme jigéen ñi yéen ñi jigéen ñoo ko déggandoon ñu ne feebar sida wa nekk na feebar boo xam ne boo ko amee yow mi ëmb bi mu nga koo teree jox si sa doom boo xam ne yuraamu ku ko am fexe nga gis lopitaan bu la gën a jege waa buntu lopitaan bu la gën a jege ne la si jàppale mu lopitaan fii la ak foofu buntu jege rek ne la jàppale ñu aar lañ mission comme yow feebar bi doo ko mën a jox sa doom boo xam ne yuraamu kon Dame balaa ñu tëj wax bi ko waxtu bi almost jeex na léegi la bëgg a léegi loolu nga tàggatu.
ok jërëjëf Muhammed an Ibrahima léegi ma dem si soose nga daa man ndigol fana ya comme kuma sutu yakama dron alhamdulillah natran kanin soto watini wati kata into the media kamol karandi kuwalla men yalon ko wala ni HIV kurawti mulia faham rek mo be da handle e bajara na dindol men mina sama ani men fana ma soto e bajara ko se fan tankano fantanko munati wala nabe mola ina kakafu ise fantankano munati wala kondomo alsa fama sungaro kono kondomo wala fenti mesa mo tankano bari ni family planning borol men ya ni pengo ni zedal nyomi ke beke mola buga mo tanka HIV la men sa mo tamba HIV la wala ni fam protect with condoms e bajala ko nabe nyindula tendo saw nabe nyindula tendo sawandila so ni mukula de yalon ko akum mata bakale lafta pour momo yalon ila jata kende ay lafta lonna na lefta no to weda lefta damen to mi yalon ko iseke ka kesi kisulol ke e kesi kisulol ke namantere la ibe karandila pour se fatanga nyame na be la fana ba fole be boro min tala me yalon ko batinna ila life be ila siyo be jam fala e sasa me so be tala le bala ba jala ko alhamdulillah mo be tankala
Uncle Dam ñu la jaajëfal bu baax ñu la wax ne jërëjëf si sa teewaay bi tey kontaan nañ si bu baax. Thank you again Mr. Dibba for coming answering to our call. And please today you have make us understand all what have embedded about the HIV virus. And then we also telling thank you viewers and those who are following us. And of course we also going thank you Mr. Ebrima, the coordinator of course the director of this Suicide TV. We saying thank you. See you next Wednesday inshallah for another Thank you.